Patient is 42-year-old, status post motor vehicle accident, resulting in left tip fracture and TBI. Patient is now non-weight bearing on left, Rancho level 6. Overall strength is good, balance is fair plus dynamic. 1, promote overall improved conditioning. 2, improve functional ability. And 3, improve overall balance.
Okay, tell me what you're doing and why.
Okay, so she will be using crutches
Okay,
because she's non-weight bearing. So we're doing a non-weight bearing gait, and taking her to the parallel bars for balance training.
excellent.
So hi Diana. I remember last time we were working on sitting dynamic balance. So we want to incorporate new activities now since she's
Okay.
on stage 6.
And when you're talking to patients with traumatic brain injury, don't forget you should alter your commands, right? Short, simple, concise. So you might, I mean, brain, 6 is okay, but I might say, let's go over here. Something simple. The more you start to explain, the more confused they get.
Okay. So then we're gonna go over it. Okay? Alright, so I want you to not put any weight on this side, okay? And we're gonna
Say
come up.
leg up.
Leg up, foot up,
Good.
keep foot up.
Foot up,
Okay.
stand up, let's go.
Okay, foot up, stand up, let's go.
You don't have to say exactly what you're saying.
Alright, keep foot up and walk, good.
Little hop,
Hop,
hop.
hop.
Whoa. Which really needs those balance exercises.
Okay, alright, so, put one hand here. The other hand there. Hold. Alright, so now we're gonna practice weight shift, so, do not bring that foot down, okay? Alright, so I'm gonna shift you this way. I want you to hold for 15 seconds, okay? Come back.
And you can do things like, let's count, just, again, re-education, re-education, re-education.
So let's count. 1, 2, 3, 4, 5,
You're making sure they're
6,
breathing, you're
7,
making sure that.
8, 9, 10, 11, 12. And now we're gonna go back. Good. Count 1, 2, 3, 4, 5, 6. Okay. Now forward.
Again, be careful of their judgment, okay? Make sure you are ready before you say go back.
Okay.
Because I'm telling you, they're just all over the place. You be ready and then command. You be ready, then command.
Alright, come forward. Good. 1, 2, 3, 4. Count with me. Okay. Good. Alright, so now Joey is taking over.
Okay, so tell me about your task you're doing
Next.
just give me the sentence, just so you can, you write it in.
I am doing weight shifting on parallel bars to improve overall balance.
Okay, but
Standing
it's
balance.
non-weight bearing on the
Non-weight
right?
bearing on both. Yes.
Just so that if I treat your patient today and I read what you did, I need to know what you did, okay?
You doing Diana? Joey? You're gonna go back to the bed.
Huh?
Bed. Use crutches. Turn. Wait. Turn. Turn. And walk over here. Going, hop, hop. Turn. Sit. Slow.
Crutches out.
So we're gonna do like a reciprocal leg and arm raises for conditioning
Okay.
and coordination.
Okay, in
So-
sitting.
And
Instead of
Supine.
or supine, okay.
Supine. Lay down, supine. I want you to copy me. Okay. 1, 2, 3. Do that 10 times. Ready?
Great, what are you trying to achieve, Joy?
We're doing conditioning and coordination. We're doing coordination.
Okay. And how many times?
3 sets of 10.
Okay. Or if you're doing endurance, you could do
3 sets of 20.
1 set of 30.
Oh, 1 set of 30.
Right? For conditioning, you probably should just do continuum, right? Okay.
Yeah, longer than
Right. Okay, good.
that. Sit up. And
Remember how to stand up? No.
For this?
Okay, put no weight on your
Nice and
left,
loud,
okay?
please.
Louder.
Put no weight on your left, okay? Okay, now.
There you go.
That's
Alright.
Okay, I'll switches. Now, today I'm going to teach you how to wash your hands, okay?
Okay.
Okay, good. Now, hop to the sink.
Is this the sequencing for
Yeah, go to the sink.
ADL?
Promote functional ability.
Okay.
Okay, you remember? Okay. Dana, do you remember how? No. Okay. Okay, open. Turn the faucet. Yeah. Wet your hand. Okay, I'll put the soap. Soap. This is soap. Okay. And good job. Clean your hand. Water. Wet your hand. Okay. Close it.
Wash my face now. It's over there.
Do I need to tell her to do it again?
You know, the more you repeat it, the better. Okay, so if we had to put a sign up on her bathroom mirror, okay, about washing the hands, let's try to sequence it. So,
Turn faucet on.
okay, right faucet,
Cold.
left faucet,
Rinse.
because you don't want it hot or cold, you want to mix it, right?
Rinse.
Right faucet, left faucet, then
Rinse hands.
soap,
Soap first.
well, it's too complicated. Wet your hands first.
Soap.
Okay, soap, then
Rinse.
rub,
Scrub.
scrub or rub, then
Rinse.
rinse, then right faucet off, left faucet off, then dry. Okay? And believe me, that's what you have to do for some of these patients. You really have to sequence it out and you just write the words. And I usually, you know, if it's in the bathroom, you put it on the mirror. If it's in the kitchen, you put it on the cabinet. Okay? And it seems, things that seem very, very simple to us are really complicated for them. I mean, let alone doing something like laundry, right? Whoa, that's really complicated. Because it's measuring the soap, it's setting the temperature of the water, it's setting the cycle, it's sorting. You know, you don't wanna wash your red pants with your white pants, right? Super, super tough, very, very high level level activity, believe it or not. Okay, but but even something like washing your hands, brushing your teeth, not so easy. So just sequence it with simple words. Okay? Good, nice job. Okay, pick your patient for your home program. Josh. Okay, read out loud for us, Josh, and do it.
Number 1, standing on uninvolved right leg while stabilizing yourself with a chair in the right hand.
We don't have to
Have
go to
fam-
the sink.
What?
Against the wall, in front of the wall.
We're gonna pretend this is a
Yeah, or something, to support. Okay.
This is with my right hand.
Yeah, hold.
Oh, standing? Okay. While stabilizing yourself with a chair in the right hand. Have family member randomly group colored stickers on a wall.
We will need tape.
Tape.
Yeah, we have tape, we have different already.
Okay, so that's good, you got your family
Match
involved.
like colored stickers together. So.
It's just matching.
Something on it.
Matching. So put different color here. Matching the pink with the pink like that.
Oh, I'm just like holding
Yes.
it.
So is he supposed to take them off, or is he just supposed to
Matching.
point?
Yes,
Just
point
pointing.
one match.
Okay.
Like the colors are match.
Okay.
Okay,
And they will be like the same, the blue with the green, first bullets.
okay, so what are you trying to achieve there?
Balance, coordination.
Okay, so this would be good if what? What do you need for this?
Memory or
Family.
Family.
Yeah.
Right? So let's try to give him something to do on his own.
he can be
Nobody's
sitting,
home.
He can be sitting with
Good.
the
Have a seat.
card
Yeah,
laid out.
yeah. Good.
And
Yeah, just match them.
match them.
Good. Yep. Okay, so if family's there, you can do a higher level activity like reaching and balancing and coordination. If family's not there, or he's young, he's home most of the day, make sure that you do a safe environment. Okay, nice job.
Number 2, single leg raises. Lying on your back in a bed.
Flex single leg by the hip to raise leg in the air. Repeat on other leg. 3 by 5 for each leg.
Okay, what's flex?
Yeah.
Lift.
Lift.
Okay,
Lift leg.
so tell him again. Lift your,
Lift one leg in the air.
or lift your leg towards the ceiling.
With,
Leg towards ceiling.
drop. Next leg.
Oh.
Slow.
Everything slowly.
So it's 5 seconds or something.
Yeah, yeah, that's good. Bring your leg up towards the ceiling, hold for 5 seconds, 5 seconds, and then bring it down slowly. Good,
One and then.
repeat. Okay, good. Okay, do you see how you have to really alter your instructions, your home program, a lot of things for someone with traumatic brain? Let alone get them to concentrate, let alone get them to stop laughing, let alone get them motivated because they're very depressed sometimes. So this is a difficult patient to, work with. Okay, you wanna read your note for me?
Yeah. So subjective patient reports difficulty with sequencing such as washing hands, states of feeling insecurity in standing.
Good.
For objective, we did perturbations in standing on parallel bar with minimal assistance, non-weight bearing on the left lower
Good.
extremity, fair plus strength. We did 15-second holds, 8 times.
Good.
Reciprocal movement of upper extremity and lower extremity, and supine for 1 minute.
Nice.
We instructed 5 times in washing hands, step by step. Provided home exercise program to increase balance, coordination, and strength of both lower extremities.
Nice, nice.
And for assessment, patient improved from moderate assistance to min assistance on parallel bars. Patient felt frustrated during sequencing activities, and they improved during reciprocal movements.
Very nice.
And for plan, continue plan of care to increase balance, coordination, and strength on both lower extremities and improve cognitive function.
Terrific, good. I like the data, I like the comparison of the data. Very, very nice. Okay, the main thing is, when you finish your note, can you treat that patient? Do you know what to do? That's what you should always ask yourself after you finish your note. If I had to treat this patient tomorrow and I didn't know them, could I treat them? Okay? All right, very nice. Okay, next group.
Oh, yeah, this one.
Oh, it's there. It is. Oh, can you take this? Is that it? Sorry. Stand by.
One thing I have like the weight card. No, it was pink. I have it on the phone.
There? Oh,
Card is missing an edge.
I have it on the phone. Okay.
You filming, Kevin?
okay, so patient is 24 years old. Status post gunshot wound to right cerebral area. Patient is in stage 5 Rancho's, weakness noted throughout the left side, with decreased ability to ambulate. Strength of uninvolved extremities is good.
Okay, remind us what what stage 5 is.
Confused appropriate, right?
Confused.
Confused.
Inappropriate.
What is it?
Confused appropriate is 6.
Oh, okay.
Yeah.
Confused inappropriate. Same thing, no, just kidding.
Okay.
Okay, confused inappropriate. So, we're improving strength of left side, improving ability to ambulate, and performing transfer training. So, I guess we can just go in order.
Yeah.
Start.
You want to do manual resistance first?
Yeah.
Okay. Oh, I need the chair.
So,
Oh, she's gonna do it.
first, we are just gonna do some manual resistance to improve the left side.
To improve strength?
Strength.
Okay.
Yeah, to improve strength on the left side. Okay, so hi Darren, I'm Liz.
And what's the strength to begin with? I'm sorry.
It just said weakness noted.
Okay.
Didn't say any,
Okay.
great, weakness noted.
Okay.
Hi Darren, I'm Liz. We are gonna strengthen you, okay? So take this leg, push up into my hand. Up, 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 up. Good, relax. One. Strong. Okay. Push out. Push, 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 push. Good, relax.
But you stabilize the knee,
Sorry,
yeah.
there you go. I always forget that. Okay. So I can leg, take your arm. Pull me. Pull, 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 pull,
Don't forget
pull.
to stabilize above the joint.
Okay, relax. And push. Push, 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 push. Good. Relax. Push up against me. Push, 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 push. Good. Relax. So, yeah. So that's improving strength on left side. Improved ability to ambulate. You wanna do that?
Sure. So he has a.
Oh, maybe we should start with sit to stand.
Okay, let's do that. We'll do sit to stand first. But no, just sit right
Is
there.
this inability to ambulate? Or?
No, transfer training.
Transfer training.
Yeah,
Okay.
we'll just do that.
Okay.
Okay. So Darren, all I want you to do is you're gonna push off the bed, and then you're gonna put your nose over your toes, and then just put your hand right on here and stand up. Okay. All right. 1, 2, 3, push. Okay. Yeah. Good. And then just to go back down, just let go of that and reach for the bed, and then just sit down.
Reach,
Reach, reach, reach, reach. Good.
push, stand, reach, sit.
Yeah, and then just, yeah, exactly. Your hand goes by your side to stabilize you. And then back to contact like I'm on the weak side.
Okay. And how many times would you do that?
About 10 times, or
Good.
until he fatigues.
Okay. Good.
And then what's the last one?
Parallel bars.
Parallel bars with, okay, parallel structure, yes.
Okay, so Darren, the same thing. Okay, yeah, exactly. You're gonna reach for the walker, push, reach for the walker, good. Try it. You just start walking. Good. Okay. Go ahead and put your hands on the bars.
come toward me. Arm and leg. Arm and leg.
Yeah.
Good. Arm and leg.
You see what she's doing, lots
Arm
of
and leg.
demonstration, lots of
Good. Arm
cueing,
and
lots
leg.
of tactile.
Good. Arm and leg. Good. Arm and leg. Nice.
And then we had the idea of using the foam pads once he progresses a little bit to like
Okay.
increase his balance. And if he couldn't do it at first, using a 4-point gate first, so just kind of like this thing. If he
Okay.
couldn't do it, and
Let's
then
cue,
progress
let's cue
to
for
that.
a 4-point.
For 4 point? Wait. Okay, you want to do it back?
Sure, yeah, because it's coming this way anyway, yeah.
Okay.
That's it. This arm? No, 4-point, right? This one, this leg, this arm, this leg. Arm, leg, arm,
Nice.
leg.
Good. Good, very simple, straightforward, cueing, tactile. Good.
I think that's it.
HEP?
Oh, yeah, right.
You need a patient? Anybody?
Joey. Throwing it back at you. We illustrated it for you. It's a stick figure.
Okay, read it out loud for us.
When you are lying in bed in the morning, lay on your back and bend one knee and keep the other leg straight. Lift the straight leg slowly up and lower down.
Straight leg raises.
Let's see if it gets.
Look at the drawing. Wait.
The one directly underneath it is the one.
Lay on your back, bend one knee and keep the other leg straight. Lift the straight leg up.
Okay, and then I check, probably just would add up and down
Reset the 10.
smoothly,
Yeah.
right?
I believe it did say
Yeah, the
Oh, did it? Okay,
patient's
sorry.
mind.
Straight
Shows
legs
sorry.
slowly up and down.
Thank you. Thank you.
To water bottle for
No, don't use actual.
hold a water bottle and bend your elbow.
Wait, oh, yeah, that's right.
You know, mouse works well for home soup cans. They're usually about a pound or so.
Water bottle. Abduction? It's abduction. Hold a water bottle and raise your arm up and down by your side.
Did they say how many times?
No.
No, sorry. 10 times.
10 times.
Or 2 by 10.
Okay.
Okay,
Sweet.
nice.
Shoes got wet on the way here, so it did.
Oh.
Oh, the note? You want to read the note?
Alright, so patient chief complaint difficulty with ambulation and transfer between positions, wants to be independent with ADLs. Patient performed manual resistance training to upper extremity and lower extremities. Ambulation training in parallel bars with contact guard and minimal assist.
2 minutes.
2 minimal assist.
Yeah.
And
Because you can't do both, right? Contact guard is one thing, minimal assist is something else. So it's 2, contact guard or slash or whatever.
And sit to stand with Hemi-cane requiring contact guard review home exercise program.
Good.
Patient tolerated treatment well. Able to
How many people see that in the notes?
able
What does
to
that even mean?
We're okay.
What does that mean?
Your note's done at 11 o'clock at night.
That's when you don't know what to do. I know.
are able to demonstrate appropriate transfer after verbal cues and tactile cues, and simple repeated instructions with rehab potential. Continue with current plan of care to increase strength. Ambulation ability and transfer training progress as tolerated.
Okay, at least put something else besides. Okay, good. So if you review the home exercise program, give me something in the assessment you can say about that.
Patient was able to demonstrate home exercises after instruction. Something like that.
Yeah, or, they need less cueing now with their home exercise program, or they're independent with their home exercise program. If they're independent with their home exercise program, what are you gonna do? Progressive, right? Give them something else. Give them something a little bit harder. Give them more reps. Give them more weights. Give them something, right? So you always want that story to continue. They're independent here, good. Now we're adding this. Oh yeah, good. They achieve this, now we're going towards that. They achieved their short-term goals, now we're working towards the long-term goals. They achieved goals 1 through 3, now we're working on 4 and 5. Okay? Always a story, always a progression. Always, unfortunately, proving to the insurance company that they should pay, right? Because they're getting better. Okay, good. Nice job, guys. Very nice. Number 3.
All right, we have a 60-year-old status post fall off the roof. Patient sustained a right shoulder fracture resulting in a open reduction internal fixation of the right side. Now it's non-weight bearing on the right shoulder. Patient is Rancho 6. Balance is good. Our goal is to improve balance, improve ambulation, and help an active assisted range of motion of the right shoulder. You want to do something?
Okay, let us know what you're doing and why you're doing it.
Okay, for balance, let me check the okay. Okay, so for balance testing, Steve, you can do the Romberg test. So I'm gonna have him stand up. Okay.
Okay, what activity is this?
The Romberg test.
What activity is it?
To improve balance.
To improve balance, okay.
Yeah, to improve balance.
Yeah, so a
Romberg-
lot of the balance and coordination tests and outcome measures can also be used for treatment, right?
Hey Dennis, I'll be assisting you to stand up, okay? Now, count of 3. So I want you to push with your left hand, and then with your left foot, try to stand up, okay? Now, count of 3. 1, 2, 3, go. Very good. Okay. Now, I would like you to do the Romberg test. Okay. So I would like you to close your eyes, and then I'm gonna remove the guard from you, and then I'm gonna
Feet
observe
together,
you.
don't forget.
Okay, feet together, please. Thank you. Carefully, carefully.
Close as
Okay,
you can.
good. All right. All right. I'm gonna remove my guard with you, and he's falling. He's good. Oh. Okay, good. Stay there. All right.
And we would do like a couple sets, maybe 3 sets in time up just to see if there's
Okay.
changes and improvements.
Want to do the sharpened Romberg?
Sharp.
Yeah.
One leg?
No, 10. 10.
Okay.
Ah.
Okay. This for round 1. A little bit more. Don't worry. You'll be over soon. I guess that's good for now, right? Okay. All right. Now for the next exercise would be for you to improve balance. Is try to raise your right leg, okay, if you can. All right, as far as you can. Standing on one leg. All right. I'm gonna guard you, okay? All right. Just for improving balance.
Okay, how would you make it harder?
I'll make it harder. Maybe you can, if you can do it, maybe in the front. Yeah.
Okay.
Okay.
Even harder than that. How would you progress?
Weights.
Put on the RX,
Hmm?
on the phone.
Okay, but even before that.
How about that halfway?
Okay,
Like-
eyes closed.
Eyes
closed.
Okay. All right. You can do it.
their balance, if they were having difficulty maintaining that single leg stand, what would you do?
If he's already standing, right? And he's
He's having difficulty.
go.
He can only pick up his foot for like 3 seconds or 2 seconds.
Maybe with assistance like that. No, I'm.
Think even simpler. Use the
Oh, okay.
partners. Exactly.
Hold on.
Okay?
Yeah.
I'm trying to get, it's funny that, when I did this site visits, one of their concerns was that students don't always know how to progress. And I always talk about progression, and I have in the past, but I think it's a hard thing to think about, like, okay, you're gonna do the exercises, and then, like, now what, right? So I'm gonna try to, help you guys hopefully talk more about progression, okay? So if you couldn't do it, you'd put him back in the parallel bars, right? If you could do it, you would have him close his eyes, right? Okay, good, nice.
Look side to side.
You can do distraction, look side to side, look up and down.
Remember we were talking actually.
Yeah, earlier.
Yep,
All
excellent,
right, next.
great.
Still a patient? We were gonna do tandem walking.
Okay, and this
You
is
wanna pair
for,
out the tandem patient to help ambulation.
great.
Okay, so I'll be a therapist. Hi, Michael. I'm Dennis. I'm gonna put this piece of tape down.
Oh, perfect.
Okay. And
We
now,
actually do have tape there somewhere.
what I want you to do, step forward with your right foot. Okay. And now that left foot, launch right here. Okay.
Heel to toe,
Heel to toe. Okay.
heel
Heel to toe.
to toe.
Where would you be guarding?
Heel to toe. And I'm on the involved side. Heel to toe.
Might go into stance of the gate stance, because then you really got it. Should forget gate stance. Yep, there you go.
Yeah, but you wouldn't want to put your hand on
Right,
his shoulder.
that's why.
No, you can, you're not gonna pull the shoulder, but, you can, you have to be somewhere where if he goes forward, you got it, right?
Yeah.
I might put a gate belt on him in this case, so at least you can pull him back if he goes forward, and not injure his shoulder. Do you know what I'm saying?
Wow, look at that. Here. What was the other one?
Tandem walking. No, braiding.
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 Okay. So now, Michael, I want you to step past this line with the right foot. Okay, and the left foot is gonna come behind. Okay, and now the right foot back here. Right foot forward. Left foot forward. Right foot forward. Left foot back.
Confusing, right?
Right foot back.
Try right in front, left behind.
Left in front.
Left in front,
Right in front. Left behind.
left behind. Good.
Right behind. Left in
Left
front.
in front,
Right in front, left behind,
left behind.
right behind, left in front.
It's a little hard to cue breathing, but especially with a traumatic brain injury.
It's also harder
But-
without tape.
Without a
I
vision.
did
Yeah.
this in my clinic with one, but I didn't have any tape, and I'm like, oh, put your foot there, because she can't see.
Yeah, that's why,
Phones or no?
you could.
Or what's easy is,
We have tape
I've
here.
seen, step ladders, like, they use them a lot for football.
Yeah, the
Do
coordination
Inside the
ladders.
square,
Yep.
outside the square, inside the
Yep.
square, outside the square.
Yep.
Um,
And one we're gonna go through with the outcomes, it's called a 4-square test. And you can just take like 2 canes, or you can take tape and just make 4 squares. And you do this kind of thing. You do this.
Just go to the arcade and do Dance Dance
Yeah.
Revolution.
Yeah,
We still have
dance
it?
yesterday. Yeah.
They have it for like,
It's
the
excellent.
Wii Sports and stuff, they have a ton of the games, like
Yeah.
on balance and coordination.
Yeah, at the Upper East Side Rehab, they have a lead there. And they have the patients they do bowling and tennis. I think those are the 2 things that they do. So they do a lot of coordination kind of things.
Yeah, they did that a lot inpatient, peds, hospital.
Yeah, even adults,
Oh,
something
yeah.
fun,
Mhm.
something different. Good.
Yeah, and for the active range of motion, do you wanna?
Yeah, I
That was
guess
the home exercise. Yeah.
Well, yeah, but we were gonna use the pulley, but
Oh, yeah.
we didn't have it here.
It's not here.
Yeah, but anyway.
There's one in the other room, right?
Yeah, there is.
Yeah.
Because that's a great thing for him to obviously assist the
For
runner.
sure.
But we can simulate it with, or not simulate, but just do other things with the cane. So we were gonna do this for the home exercise too, but I would have him hold it with both overhand grip, straight arm.
Should we have someone read it? Or?
Oh,
Well, I'm
is this the
saying-
home exercise?
Well, we had this for the home exercise too, but I'm saying he could do this in the clinic a whole bunch of ways. Like he
Okay.
could just do raising like
Okay,
this.
so you can
and go
instruct
side to
him.
side, yeah, and then the home exercise would be to replicate it at home.
Okay, do you have it written?
Yeah.
Okay, pick somebody.
Yeah.
Laying on back. Hold cane, long waist with elbows.
And if you have a cane, you can use a broomstick.
Say that again?
A broomstick or something, you know, like there's a lot.
Yeah, it would be the Swiffer in my house.
Yeah. It's,
I love my Swiffer.
oh.
Reach over head, floor and back to starting position.
Mhm.
Slowly 10 times. So I should reach for cane or
Yeah, doesn't it say hold cane?
reach overhead to
Yeah,
floor.
wait, lay on
whatever.
back, hold
Lying on
cane.
back.
Hold cane, long waist
With
with
both
elbows
hands.
straight. With
Doesn't say both hands.
not
Oh.
both hands. I don't
That
know.
was a small element.
So with
Okay.
both hands?
Yes.
Yeah.
Exactly.
Okay, with both hands, reach overhead to the floor. So
Yep.
you will- Okay. It says 10 times,
Mhm.
okay, so, okay.
Don't forget, everybody's missing the word slowly.
It says slowly on there.
I'm sure.
Underline.
It's always a remind,
Didn't
for
forget
everybody
to-
to do it slowly, right?
Okay.
All right,
Good.
next.
Okay.
What's the advantage of doing cane exercises in supine as opposed to sitting?
Safety.
Gravity
Gravity.
Gravity assisted and safety.
Yeah.
At least for half the range, you have gravity assisted, right? Which is usually where you need it the most, you need it in range.
Bring cane from right to left side, slowly, 10 times.
Good.
And just another.
Nice.
Okay. And lastly, climb one step and come back down on same leg, 20 times each side. So everybody stairs.
And we
Okay,
were
so-
just assuming that if he has a railing on the left-hand side, obviously they would use it. If it's on the
Step.
right-hand side, we would have to maybe modify it.
Okay. And if they don't have steps at home, what are you gonna use?
Um,
A stool,
I'm sorry?
a step stool.
Steps.
Yeah.
Yeah, most people have something to get up in their cabinets with, right? Just have to be careful that, you know, that they're safe, that they can hold on to something if they need it.
I mean, their balance is good, right?
Yeah.
So
Yeah.
as long as they have something,
Yeah.
should have a really on both sides.
Nice.
Yeah.
You're not weight bearing on one arm though.
Yeah,
Yeah.
just the left arm.
That's all, right?
Yeah.
And you said only hold on the railing with the left arm?
Yes.
Okay.
Did we?
Nothing good.
I don't think I put anything related to
Okay.
handrail.
Yeah,
Well, when
because
it
you
hurts
don't
on the
want them
right arm,
weight
you'll let go.
bearing. Weight bearing of upper extremity is hard. You always have to constantly remind, you
So
know?
I could still do the cane because it's assisted.
It's okay to do the cane because it's an active assistive exercise and they're not bearing weight down. But with the stairs, you'd have to remind them, don't only hold on with the whatever hand you want them to hold on to. Okay, good. Your note please.
Patient complains of trouble walking and stiff shoulder. right shoulder. It also says he is forgetting how to brush his teeth. For the objective, we performed the Romberg test. Patient lost balance at 20 seconds, 5 seconds, 23 seconds with contact guard. Patient did single leg balance in parallel bars, 2 sets of 30 seconds on both legs with contact guard. Patient did 6 times 20 feet tandem walking with supervision and 6 times 20 seconds of braiding with vernal cueing. Patient performed active assisted range of motion for right shoulder, utilizing pulleys, and balance was for 5. In the assessment, the patient increased the time of the Romberg test. Patient completed right single legs standing with losing balance only 1 time. Patient needed correction of braiding exercise and improved right shoulder flexion, extension, and abduction. For the plan of care, we're going to progress with the single leg stance and improve awareness and orientation.
Good. Nice. Very nice. Good job. Guys, your documentation's really good. Okay.
Next.
What other word can we use for planning instead of continue plan of like to start it off with?
What other word can you?
What other like phrase can we use instead of saying continue plan?
Or follow, or progress, plan of care.
So, patient is 18 years old, status post-motorcycle accident. Patient is having difficulty with ADLs, activities, and remembering sequence. Strength 4 out of 5, and balance is fair. Instruct patient in sequencing of ADLs, perform balance exercise, and perform coordination exercises.
So we're actually gonna leave the ADLs for last for like the home exercise program. We incorporated into that.
Okay.
And then performing balance exercises. So it didn't really say whether it was in standing or whether it was in sitting, so we're just choosing the sitting.
Okay.
So, hey Kevin, I'll be your SPTA. So, Brink, you're sitting here already. So, you're gonna close your eyes, right? And then I'll be here with you. I'll push you over side to side, and you're gonna try to keep your balance, okay?
Alan, do me a favor. Sit in a chair without arms, like this one, and then hold his knees with yours and see if you feel any more stable.
She feels more stable.
Mm-hmm. And well, both really. Put your knees together, Kevin.
But if he falls off, I guess someone will be behind him to catch him.
Okay.
So,
But put yourself in a situation that you have him, just in case.
all right. So we're gonna go
There
to
you
the
go.
side.
What do you
There we
think? Do you feel more stable than when you're standing?
go. I feel better when I'm standing,
Do you? Okay.
personally.
Okay.
Yeah, I'll try this.
Because he's tall, that's why.
Still
Yeah.
block his legs though, if you understand.
Yeah, you can.
I feel so.
Try it.
Try it like this.
Try standing if you feel better standing, because he's taller than you, so. I just want you guys to figure out different ways to put your
You sit
body
closer like that.
so that you feel safe and the patient feels safe. That's probably okay,
There
right?
we go.
You feel good like that?
We're going backwards now. Forwards. Side to side again. Alright. Next. See, she's the PTA also, so she's got one. So now we're gonna do a
You have
coordination
to
exercise.
really watch these patients, I'm telling you. You have to watch them so carefully because all of a sudden they just go.
So coordination. So try to get the green one. Alright, put it on the blue. Alright, now get the pink. Put it where the green is. Get the pink again. Put on this one. Let's get the green. Put it on the pink. Let's try the other arm. Blue. On the green. Pink. On the blue. Pink again. on the blue. Alright.
Nice. So give me a sentence of what you're doing. Performing,
We're performing dynamic sitting balance
okay?
across the midline.
Okay.
And I guess in abduction, flexion, etc.
You don't even have to say that, but you could just say sitting on the physio ball.
Sitting on the physio.
Okay, good. Nice. With close guarding, yeah.
Let's see. And also regarding the patient sequencing, ADL, that's going to be a home exercise program.
Okay, just let me ask you a question. If he was a mess on that physio ball, what would you do?
Wheelchair.
Put him on the mat, yeah.
You could also do like heel to shin slides as well too for coordination.
Oh, let's try it.
Well, I mean, you could regress with there, but like you can do there. if you
Okay,
want.
let's see it.
Alright, Kevin, so you bring your, the back of your heel to here, and you're just gonna go from the bottom to the top.
Slowly.
Slowly, nice and slow.
That's hard.
Yeah, it is hard. It's
But yes,
good.
so yeah,
It's a good
regress,
progressive exercise.
yeah, regress to here, and then if it's, getting easier to challenge it, you can just do eyes closed as well too.
Ooh, let's see it. Let's see if we can do that.
Yeah.
Hold on.
Alright, so yeah, shin to the bottom and then raise it up to the knee. So
Slow.
nice and slowly, 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 slowly.
Oh, lots of stuff going on there.
Yeah. So,
Good.
Alright, so can we have someone for the exercise program? Let's do.
Did you do them all already, or you did everything already? The
Like-
3 tasks?
The third one we're putting into the home exercise program. So,
Double dipping.
alright, Mike?
Alright.
So, the first one we're gonna do is gonna be brushing your teeth.
Okay.
So this is for ADLs.
I'm sorry. Oh, that's stand. Sorry, I couldn't read that word. Stand in front of the sink. Squeeze toothpaste onto your toothbrush. Hold toothbrush under the tap. Brush your teeth.
Oh, there's one.
Split toothpaste into the sink. Rinse your mouth. So I would just assume that I would know to turn the water on.
Yeah,
Yeah, wouldn't, I'm pretty sure it's there. Turn on the faucet.
Now it says stand in front of sink, squeeze toothpaste onto toothbrush, hold
Try this
toothbrush
one
in
over
sink, brush your teeth.
Sorry for handwriting.
No, it's fine. Mike.
Yeah, this
No,
is
I just didn't see.
It's tough, because how much do you squeeze, how much do you
Oh,
pour
so here it's
down,
turning
what kind of water do you use?
Okay, what's the next one?
You know, when you start
The one
to
above,
break down
single
these
levels.
tasks that we do like so
Well, this is
automatically,
pretty common.
Yeah.
you have to explain it from scratch,
Oh, wait.
it's not so
Sorry, stand in
easy.
front of the kitchen. Okay, stand in front of the kitchen counter. Have your hands off,
Yeah.
yet over the counter to catch yourself in case you feel like you're going to topple over. Stand on one leg for 10 seconds. 10 times. Repeat on the other leg. Yeah, that's good. That's perfect.
Okay, nice. Yeah, we were just saying that, you know, a simple thing like brushing your teeth is hard, right? You know, when you turn on the water, when you turn off the water. I mean, I might even just give them, like, say, you know, rinse your mouth with a, you know, water from a cup or something, you know, just, you know, it's complicated. Brushing your teeth is hard when you think about it. Because it's like, what is toothpaste, first of all? Which one? You don't wanna brush your teeth with the shaving cream, right? You don't wanna brush your teeth with soap. And literally, I have to be honest, they forget what toothpaste is and what it looks like. You have to sometimes be, you know, for people who have really severe brain trauma, you know, they'll look at things on their sink. I've worked with so many patients at home, and they'll just look at things on their sink, and you say, well, put the toothpaste on your toothbrush. And they'll go, well, which one?
I was also kind of thinking, like, you know, when I was doing these exercises with Kev. So let's say like some of them, all of them on this side were green, all of them were blue on this side.
Mm-hmm.
And then, okay, get the green first, get the blue first, blah, blah, blah. And then at home, we could probably color code the toothpaste. The toothpaste is green. So, you know, let's get that one first. Get, you know, a toothbrush is blue, so, yeah.
Good.
For our soap notes, subjective, we have patient feels uncomfortable, uncoordinated, and has difficulty brushing teeth. Objective, patient performs sitting static balance with perturbation. Perturbation. That word. Oh, thank you. Patient
Or nudging, you can also use nudging, when you nudge someone.
With nudging on physio ball containing catching and throwing tennis ball, seeing dynamic balance in a chair. Oh, I can see that. Give me 1 second just to get closer.
Okay.
Patient performs same static balance with perturbation on physio ball, catching and throwing tennis ball, sitting dynamic balance in chair, reaching for colored cones. And this was to say 30 times, each of them is supposed to be 30 times. Assessment, strength rated at 4 out of 5, fair balance. Shows improvements in right and static balance. That's coordination requires work and dynamic, and vocal cues are needed. And the plan, color code items for brushing teeth, like I said before. And next, next visits and stuff. Sequencing, there we go. Sequencing exercises, that's the difficulty of dynamic activities.
Okay, nice job. Good job, guys. Okay, we have a half an hour left. Every group to go back to the board. Group 1